Namaste, myself JB Shivi Saxena, academic physiotherapy and diagnostic, and my discipline is medical laboratory technology. And my topic is antibiotic susceptibility test. So, firstly, modern era in antibiotics being with Fleming. Uses of antibiotic sensitivity testing. So, antibiotic sensitivity testing, a laboratory. So, a laboratory test which determines how effective antibiotic therapy is against a bacterial infection. So, antibiotic sensitivity testing will control the use of antibiotics in clinical practice. A testing will assist the clinician in the choice of drug for the treatment of infection. Component of antibiotic sensitivity testing. So first, the identification of relevant pathogens in exudates and body fluid collected from patients. Second, sensitivity tests done to determine the degree of sensitivity or resistance of pathogens isolate from patient to an appropriate range of antimicrobial drugs. Third, assay of the concentration of an administered drug in the blood or body fluid of patient required to control the schedule of doses. Antibiotic sensitivity testing is essential of selection of antibiotics. Isolation and identification of bacteria precedes the selection of antibiotic testing method. So, use of antibiotic sensitivity testing. So, help to guide the physician is choosing antibiotics and accumulate results on different pathogens. Their sensitivity will guide the physician in choosing empirical treatment in serious patient before the individual's laboratory results are analyzed in the microbiology labs. So, reveals the changing trait in the local isolates and help the local pattern of antibiotics. Why need continue for testing for antibody sensitivity to bacteria have the ability to develop resistance following repeated or subclinical doses, so more advanced antibiotics and synthetic antimicrobial are continually required to overcome them. Testing for antibiotic sensitivity. The method includes several steps, including obtaining a bacterial sample, identifying the type of bacteria in the bacterial sample, and selecting a set of antibiotics based on the identify of the bacteria in the bacterial sample and obtain a control sample from the bacterial sample. Testing antibiotic susceptibility. So two types. First, antibiotic sensitivity test, a laboratory test which determine how effective antibiotic therapy is against a bacterial infection. And the antibiotic sensitivity test, the in vitro testing of bacterial culture with antibiotic to determine susceptibility of bacteria or antibiotic therapy. Example, Vernon Carvey test. So, how results to be reported after sensitivity testing? So, one should follow guideline in reporting the results and make matters simple with clear word as organism A isolate and sensitivity sensitive or resistance to antibiotic B. So such a report is relevant to present clinical conditions. So that the maximum inhibitory concentration, that means MIC, of the antibiotic for it has been measured in some way, and that if the organism is reported and sensitive, the MIC is less than a half or quarter of the concentration of antibiotic likely to be found in the infected tissue of a patient given the usual schedule of doses. What is resistance is antibiotic sensitivity testing. So resistance implies that the infection is not treatable with the tested antibiotic because its MIC exceeds achievable safe tissue or urine level. So intermediate sensitivity means they show a unimodal distribution, but they can often be misclassified as sensitive or resistance if this rested. How to pattern Kave well testing? So the basic is easy. The bacterium is swabbed on the agar and the antibiotic discs are placed on top. The antibiotic diffuses from the disc into the agar in decreasing amounts. The further it is away from disc, and if the organism is killed or inhabited by the concentration concentration of the antibiotic, there will be no growth in the immediate or around the disc. This is called the zone of inhabitation. So this image, this is a step of antibiotic testing. So antibiotic assay by the zone of inhabitation method. Okay. So next, sticking the inoculum. So carvable also barrel carving. This diffuser antibiotic susceptibility testing apply a defined inoculum direction to ensure confusion. Okay. Making proper inoculum. So swab a Muller-Hilton plate with each of the bacteria, dip a sterile swab into the broth, and express any excess moisture by placing the swab against the side of the tube. Okay. Placing the antibiotic disc. Then using a dispenser such as the one pictured, antibiotic impregnated discs are placed onto the agar surface. As the bacteria on the lawn grow, they are inhabited to varying degree by the antibiotic diffusing from the disc. Zone size differ on sensitivity pattern. So it has been determined that zone of inhabitation of a certain diameter varies for antibiotic and to a lesser extent bacterial species correlate with sensitivity and resistance to the antibiotic tested. Okay. So look at the chart for establishing the zone of sensitivity. So the zone size are looked up on a standardized chart to give a result of sensitive resistance or intermediate. Many charts have a corresponding column that also giving the MIC, that means minimal inhibitory concentration for that drugs. Okay, so so next, interpretation. So place the metric ruler across the zone of inhabitation at the white's diameter and measure from the edges of the zone to the other edges. Holding the plate up to the light might help. Okay, and the disk diameter will actually be part of that number if there is no zone. At all report is it has zero, even though the disk itself is around 7 mm. Zone diameter is reported in millimeter, looked up on the chart, and result reported as S, that means sensitive, R, that means resistance, or I, that means intermediate. Okay, so the area of inhabitation is measured with a scale. So record the result for every one of your table in the table below. So the disk diffusion method are commonly used for routine testing, and read the plates in transmitted lights, and the zone of inhabitation guides the right choice of antibiotic. Okay, so how result to be reported sensitivity testing. So maybe first session is defined. So, and second, stock method. The original stocks method, the inoculum of the control strain is evenly spread over the upper and lower threads of a plate, and that of the rest strain other the central. Third, uninoculated gaps 2 to 3 bites are left to test from the control areas. Control strain in Stokes method, the microbiology laboratory should always practice to test the quality control of their work with the uses of standard strain. In Stock method, with following standard strains, our results are compared. So first, E. coli NCTC 10418, and second, Pseudomonas aeruginosa NCTC 10662, and third, Streptococcus aureus NCTC. So stock method for antibiotic sensitivity testing. The in the strokes controlled sensitive test, a control organism is inoculated on part of a plate, and the test organism is plated on the remainder. Discs are placed at the interface, and the zone of inhabitations are compared. The use of a sensitive control show that antibiotic is active, so that if the test organism grow up to the disc, it may safely be assumed that the test organism is resistant to that drugs. Okay, the strip with multiple antibiotic can be tested in one go, and other matter of antibiotic susceptibilities testing. So other method to test antibiotic antimicrobial susceptibility so include the stroke method, e-test also based on antibiotic diffusion, and agar and broad dilution method for minimum laboratory inhibitory concentration, that means MIC determination. Okay, so testing minimum inhibitory concentration. What? So in alternative measure of susceptibility is to determine the minimum inhibitory concentration, that means MIC, and the minimum bacterial concentration, that means MBC, of a drug. And a series of broth are mixed with serially uh, diluted antibiotic solution, and a standard inoculum is applied. After incubation, the MIC is the first broth in which growth of the organism has been. So, what is the minimum inhibitory concentration? So, minimum inhibitory concentration is microbiology is the lowest concentration of all antimicrobial that will inhibit the visible growth of a microorganism after overnight incubation. Minimum inhibitory concentration are important is in diagnostic laboratories to confirm resistance of microorganism to an antimicrobial agent, and also the monitor and the activity of new antimicrobial agent. The antibiotics are diluted to various dilution to test the minimal inhibitory concentration. So next, what is a e-test? So e-test is an antimicrobial gradients technique in which 15 reference MIC dilution of an antibiotic have been repackaged with innovative dry chemistry technology onto a plastic strip. The predefined gradient provides precise and accurate assessment of antimicrobial activity against both fastidious and non-fastidious microorganisms. So multiple drug resistance organisms are resistant to treatment with several often related antimicrobial agents as described above is some of the most important type of multiple drug resistance organisms that have been encountered. Next, um, example of bacteria of clinical importance. So first, MRSA, that means methicillin oxacillin resistance, that Streptococcus aureus. VRE, that means vancomycin resistance entropy. ESBLS, that means extended spectrum beta lactamase, which are resistant to cephalosporins and monobacteriums, and PRSP, that means penicillin resistance, Streptococcus pneumoniae. Detection of MRSA made simple with this diffusion method. The MRSA among the Staphylococcus aureus need detection is in a special condition either by trying out the test on medium containing 5% NaCl with methicillin disc with 5 or 10 microorganisms. And recently, the detection was made simple and testing of oxymoxicillin or sulfonylurea disk. Newer method in mRNA detection. So recently developed chromogenic media combine primary growth and uh, selectivity with differentiation from Congolese negative staphylococci. These media show improved specificity when compared with traditional media. Sensitivity is also improved but require 48 hours incubation to achieve less than 85%. So probe agar for detection of MRSA. So BBL chromagar, that means MRSA, is a selective and differential medium for the qualitative direct detection of nasal colonization by MRSA to aid in the prevention and control of MRSA infection is healthcare setting. Staph- Staphylococcus Staphylococcus aureus to aid in the prevention and control of MRSA infection in healthcare test setting. The test is performed on anterior near swab specimens from patient and healthcare worker to screen the MRSA colonization. Okay, so this session is completed and thank you so much. Namaste.